So in the future we're gonna do a teardrop, but you can see from the hollowness here it goes all the way to the medial cheek. So we'll put some foundation for future help, and then it looks good as well. You could see that I go down and then I'm touching the bone, so I'm putting actually the filler, and it does everything from inside out. And then the bevel of the needle I already have it, and I direct it as well into the medial, into the teardrop vector. So okay, so this way we prepare this area for under eye filler in the future if she elect to do it. And then, as I showed in the other video, already did the measurement for the light reflection. So this area here would, even a little, doesn't need much, you know. Facial balancing, some unfortunately places they use it to convince people that they need tons of syringes and fillers. You can do a lot with little. You're being conservative. I always tell my patients it's always possible to add, you know, over time if needed. It's harder, I know. You can, some of the fillers you dissolve them, but I don't believe in that, you know, inject and dissolve, inject and dissolve. If you do it right the first time, you shouldn't need to dissolve anything. And again, the cheekbone actually is a good area because it lifts everything up. So, and then it's slanted a little bit up, so in this like 10-15 degrees maybe, while in the males like this. So we'll keep it feminine, we'll keep adding the cheekbone a little bit as we go to the side, lifting up. And as I told you, this as well will widen her cheekbone area, which we did the measurement, and we found that she can tolerate to have some fillers in that area. If the measurement tells us we have to stop, then we should stop and not add more, again, to keep everything look nice and natural, and follow the golden ratio of beauty. I think I have other videos as well that I explained a little bit about the golden ratio, so that's good. In the future as well, we can add a little bit here, do the Swift technique to pull the area up, and then from here we pulled it from this as well. This is Radiesse, so it is the hybrid filler, I call it. So it's gonna fill, and it's gonna as well stimulate collagen production over the next few weeks. So that's why I like Radiesse, but it needs a little expertise more than hyaluronic acid fillers because it's not reversible. You cannot dissolve it. You can disperse it. We have ways, you know, if we need to kind of soften it, but I never had to dissolve or anything. Again, it's because I'm like conservative, especially when it comes to these kind of fillers that I add slowly. So now we're doing great. We're almost done. You need a little break?
Yeah, that's all right.
Okay, all right, we'll give you a little break.